What is palliative care? In 2002, WHO defines palliative care as an approach that improves the quality of life of patients and their families facing problems associated with life-threatening illnesses through the prevention and relief of suffering by means of early identification and impeccable assessment and treatment of pain and other problems, physical, psychosocial, and spiritual. Another way of looking at palliative care by the European Association of Palliative Care is that it is the active, total care of the patients whose disease is not responsive to curative treatment, where control of physical symptoms and of psychosocial and spiritual issues are paramount. It also encompasses the family and community in its scope. Another way of looking at what palliative care is to think of it as an approach with the objective to achieving personal goals of care, where possible, when faced with progressive incurable illness. Goals of care vary between individuals, but some common ones include goals of cure, prolongation of life, to fight till the end, being well enough to have treatment, having a good quality of life, suffering as little as possible, or being well cared for near the end of life. Families of patients with life-limiting progressive illness are often profoundly affected by the challenges of the illness, to the extent that their psychological and physical health are compromised. Sometimes they are called the hidden patients. In palliative care, we serve our patient and the family as a unit, and we extend the care to the family after the patient's death. Often people associate palliative care with loss of hope. However, it's not about taking away hope, but about realigning hope to achievable goals. Living with a terminal illness can be a tough journey, and one of the goals of palliative care is to try to make that journey more bearable for both patient and family. In his book, Man's Search for Meaning, a 1946 book by Viktor Frankl, a psychiatrist who chronicled his experiences as a concentration camp inmate, he concluded that life never ceases to have meaning, even in suffering and death. And suffering in some ways ceases to be suffering once it finds some meaning. Palliative care hopes to make the remaining time meaningful if possible for both patient and family. The image of palliative care has come a long way since the modern hospice movement was founded by Dame Cicely Saunders in 1967. In the past, it was seen by many as giving up on patients, when really it's about realigning and reframing hope. Many also see it as akin to euthanasia, although it cannot be more different in intention or ideology. These days, many realize it's not hastening death and may occasionally push for a prolongation of life if appropriate. Another misconception is that once a patient's on palliative care, nothing more can be done. However, palliative care firmly believes in doing what we can to improve quality of living before death. Remember that palliative care describes an approach to care that aims to support the best possible quality of life for patients with serious advanced illnesses and their families. There are two terms commonly used that are similar to palliative care and may cause confusion. One is the term hospice care. This term is often used to describe community palliative care services for patients in the final months of life. Another confusing term is end-of-life or terminal care. This usually refers to care provided when life expectancy is limited to a short number of hours or days. In the past, these terms may be used interchangeably, but these days, distinctions are often made between the three terms, with palliative care as the overarching philosophy of care under which the rest sit. Palliative care is not limited to cancer patients. Patients with kidney failure without dialysis or doing poorly on dialysis, those with advanced respiratory diseases, those with advanced dementia or other advanced neurological conditions, and those with advanced heart diseases are all people with palliative care needs. In pediatrics, children with incurable cancers or genetic diseases resulting in multiple disabilities can also benefit from palliative care. In summary, palliative care approaches essential part of care for all life-limiting progressive diseases. And its total care model is a good example of what good healthcare is really about.